Barbara, you can start when you're ready.
Barbara, you're able to start if you want to come off mute and begin your introductions.
Okay. Welcome to Special Olympics Women in Sport webinar. Welcome to Women in Sport webinar series presented by Sheryl Foundation. During this series, we'll have incredible speakers joining us from around the world. We will discuss a range of topics around women in sport. Today's webinar will focus on women's health and sport, a winning combination. This webinar will share important information about women's health and how it affects its families and coaches learn how to support the health of girls and women. Thank you to our incredible sponsors at Sheryl Foundation who are making Women in Sport webinar series possible. Before we get started, few reminders. This webinar offers live translation in 8 languages. You can choose your language using the globe button at the bottom of the screen. Please add any questions you have for the speakers in the chat or a question and answer, or in the question and answer function. Before we go further, let me introduce myself. My name is Njovo. I'm an athlete from Special Olympics Zimbabwe. I'm an office assistant, Secretary General for Athlete Leadership Council, Health Messenger, sports assistant, and I am a fitness captain. My passion is athletics. I have competed locally, regionally, and internationally. My international competition was in the Abu Dhabi World Games. In the Abu Dhabi World Summer Games in 2019. I won silver in 200 meters and bronze in 100 meters. Regionally, I have participated in the 2020 Pan-Africa Games in Egypt. In both 100 meters and 200 meters, I acquired gold medals. And locally, I have 6 gold medals and 1 silver. I'm a member of Regional Athlete Leadership Council, where I am the health liaison officer. My term started in 2022, and it ends in 2027. In 2024, I was nominated to join the Global Athlete Leadership Council, which consists of 7 regions, where I represent female athletes in Africa region. In 2023, I spoke at the Berlin World Health Summit in my duties as a health messenger. I spoke on disability, inclusive health, and assistive technology for achieving universal health coverage. Women understands their health needs, they are able to deal with them better. Menstrual hygiene is a topic close to my heart. I showcased my project in 2023 at the Global Athlete Leadership Congress on how to make non-disposable sanitary pads, and I was awarded a Biden coin. This topic is important to me because I would like to see more female athletes maintaining dignity and confidence to participate in sport and day-to-day work, because the stigma on menstrual hygiene will be removed. Now that you know a little bit of me, I'm excited to introduce our speakers. First, you will hear from Dr. Katharina Dreser. Dr. Katharina is a gynecologist and clinical director for Special Olympics Germany. After Dr. Katharina, you'll hear from an amazing team from Special Olympics Canada, including Brock Reissner, Rachel Skanes, Sheryl Huestis, Laura St. John, and Victoria Formusa. Let's get today's webinar started by welcoming doctors that focus on women's health. Their specialties include fertility and menstrual health. Besides being a doctor, she has supported Special Olympics Germany for many years. She joined in 2005 as a unified partner in skiing. Since then, she has helped as a volunteer and as a health promotion clinical director. Welcome, Dr. Katharina.
So thank you very much, Barbara, for this nice introduction. Okay, perfect. So Thank you for this nice introduction. I give you some spotlights on women's health and focusing on puberty and also on menstrual health as in my daily routine. And first thing is that when we look at like the speed of how fast can girls and boys swim, we see that during childhood, girls and boys can swim quite equal fast. And then at the age of 10 to 12 years, something happens because boys are a little bit faster than women. And what's happening there is, if we have a look at the next slide, that it occurs puberty. And this is when estrogen starts rising. Start of puberty is regulated by different factors. So neurotransmitters, these are hormones in our brain, genetic factors. So if you're wondering when you're not yet in puberty, when this gonna start, just ask your parents. Body composition, so we know that children who are obese or overweight experience their puberty a little bit earlier than their age cohort, but still there are many things we don't know yet. And the first sign you can see as a girl or as a young woman that your puberty has begun is that your breast starts to develop. And when you have a look at the picture on the right, you can see that with the picture, which is numbered 1, you have like a girl or a boy, you don't know, because they look more or less the same. And at Tanner stage 2, so the picture number 2 shows the first stage of puberty of breast development. And then you see that behind the nipple, there's a small, tiny breast which starts to develop. And this is the first sign that estrogens rise. After 2 to 3 years, so breast develops more and more. You can see on picture 3 and 4. And when you have like the breast at the size of, in the middle between 3 and 4, then the first vaginal bleeding occurs. And this is what most of women can really remember because it's, something they really experience as their first vaginal bleeding. On the next slide, I will try to explain why I think that breast development is so crucial because during childhood, many boys and girls do sports together. And after puberty, something changed because women perceived their breasts as a barrier. And because they say, it hurts, my breast hurts when I'm, run or jump, or they even feel embarrassed because of excessive breast movement. Up to a half of girls, when we ask them, say, oh, I don't do sports anymore because my breasts are moving around. But you can help them. Just when you try to find a well-fitted sports bra, it reduces breast pain and also breast movement. And it's easier for girls and young women to talk about if you create an open-minded environment and encourage each other to speak about your concerns and about women's health issues. And why it is so important to do regular sports on a daily or at a weekly basis, 3 to 4 times a week would be ideal, is that regular sports can decrease the risk for breast cancer. And not only for breast cancer, but also for cancer like colon or at other sites. I already told you that most of the women really remember their first vaginal bleeding. And on the next slide, I give you a more global view on that because since Special Olympics, as we already knew, is a global movement, I just want to tell you that puberty around the world is the same, saying from breast development to vaginal bleeding, but the age is very different. So like in North America, it's nearly the same as in France, but even in Europe, we have different ages when the first vaginal bleeding occurs. In Spain, it's a little bit earlier, for example, and also in Brazil. And in Africa, you see it's a little bit later. Just to give you an idea that it's very individual and that it's not the same all around the world. On the next slide, I will give you a short introduction to the menstrual cycle till we speak about menstrual health. And there are 2 organs which are down in the pelvic and they are important. It's on the left bottom side, the ovary, and on the right side, you have the uterus. And but both of them are regulated from the brain. And when you the next click, please. At the follicular phase, we have the brain activates the ovaries through a hormone, which is called FSH. And in the ovary, there are a high number of eggs. And when, please, next click. In the eggs don't live like only in the ovary. They have like a little follicle where also a little water is in there, and it starts growing during the follicular phase. And next click, please. It produces estrogen. And this estrogen is important, as we already knew, for breast development, but also for a lot of other things in the body. I will come up later on it. Next click, we then have the ovulation. Next click, it means that the follicle ruptures and the egg is released into the fallopian tube. And in the ovary, there is the rest of the follicle. And if we have the next click, we can see the corpus luteum once again, which is producing, one click again, yeah, which is producing progesterone, which is also important for women's health, but I'm not that much focusing on that in this talk, because otherwise I would, yeah, just speak a couple of hours. On the next click, it comes to bleeding and menstruation, because the corpus luteum normally lives for 14 days and then it dies. And so the hormone, the estrogen and the progesterone drops, and it comes to bleeding. Many women just have pain or cramps during the bleeding, but you can do something for that. If you next slide, please. Because we know that women who are doing sports or exercise on a regular basis for 45 to 60 minutes, 3 times a week, it reduces the pain during menstruation. And this effect is shown for low and high intensity training. So it doesn't matter what kind of sports you do, just do sports, because it will reduce your pain and your cramps during menstruation. And this is shown in a various number of studies, and as I said, for various kind of sports. Next slide. Like I already told you that the menstrual cycle is a cycle, so it comes over and over and over again. But women are born with several numbers of eggs, so around 1 million. And the more menstrual cycle we have, the more eggs vanishes. And so at the age of, around 45, 48, it depends a little bit, there aren't eggs anymore. And so what occurs is menopause. It's the last menstrual bleeding in a woman's life, and perimenopause is the phase around this last menstrual bleeding. It can begin up to 5 years before and goes to 1 year after menopause. And in this phase, you don't have like the regular menstrual cycle every 4 weeks or every 6 weeks. It's quite irregular. And most women just feel a little bit, upset with that. And during that phase, you have fluctuating estrogen and progesterone levels. So it's somehow a little bit chaotic, and women experience hot flashes, problems with sleep, and so on. 12 months after menopause, so the last menstrual bleeding, we call this phase postmenopause. And here you have very low estrogen and progesterone levels. So perhaps you question yourself, okay, why is she talking that much about estrogen? And when we have a look on the next slide, here it comes to bone health. So when you think of bone, you normally think, oh, it's a dead material, but it isn't at all. We know that there are a lot of cells who are working on the bone, and one are osteoblasts. They do bone formation, so they build bone, and we have osteoclasts, which are do bone resorption. And estrogen has a crucial role in activation of bone formation and inhibits bone resorption. So normally we have like a balance, of formation and resorption. So during reproductive health, so in this lifespan where you have your regular menstrual cycle, you have like a balance. And when we have a look on the next slide, when it comes to an imbalance. So, for example, through menopause, you have really low estrogen levels, through abnormal menstrual cycle due to various reasons, it comes to an imbalance, and we have more bone resorption and lesser bone formation. And then it comes to osteoporosis or osteoporotic bone. Here on the pictures, you see on the left-hand side a healthy bone, yeah, with a lot of osteoid. So there is good structure. And if you have a look at the right side, you see, okay, there is not so much bone, and that this bone is at a high risk for fracture. Somehow you can see it on the picture, right? The next thing which is important when we have a look on the next page, thank you, is here you can see a couple of lines. What's the most interested one is the red one. This shows bone formation is at a peak until the age of 25. So here you have your so-called peak bone mass. It's the maximum bone mass you will acquire during your life. And afterwards, it keeps a little bit stable and then declines. And especially menopause, it declines a little bit faster. And so you come into osteopenia or even osteoporosis because the bone mass is somehow lost. And the black line shows if a girl or a woman doesn't have regular menstrual cycle due to anorexia, for example, then they are at a higher risk for osteoporosis in their later life. On the next page, I summarized some key points for bone health. So taking care of your bones is important. So for us women, it's important to be aware of our menstrual cycle. You have to have a look. Is it regular? Is it okay? Are we going to deal with it? Yeah. The other thing is to do regular sports training and choose food or beverage that are rich of calcium. So for example, milk, dairy products, vegetables, and so on. Another important issue is not only that estrogen is working on bones, but also on our vessels. So on the next page, I summarized a few things. It looks a little bit complicated, I know, but if we have a look at postmenopause, we see that a decline in estrogen leads to an increase of blood pressure, and also that the vascular stiffness is increased, so the vessels aren't that smooth anymore, right? And also endothelial dysfunction. So to summarize it, it means that you are at a higher risk for cardiovascular diseases, for example, heart attacks or apoplex. But we can do something. And on the next page, I showed you that sports impact our vascular health. So aerobic and or resistance exercise reduce blood pressure in postmenopausal women. And it also reduces vascular stiffness so that the vessels gets a little bit smoother again, right? And I'd like to summarize now on my last slide. Yes, that regular sports and exercise can support women's health. It reduces the risk for breast cancer and also for other cancers. It reduces pain during menstruation. It is important for our bone health and vascular health, and which is, I think, the most important thing is it's fun, it builds friendships and supports our mental health. And yeah, Special Olympics brings us together, and so we can have this perfect webinar, and I'm very happy for questions, and yeah, I'm curious of the discussion. Thank you very much.
Wonderful. Wonderful. Thank you, Dr. Katharina. You have shared lots of useful information about women's health for our athletes, coaches, and families. I invite your attendees to share. I invite our attendees to share their questions in the chat box, but also I want to ask you a question. What tips would you have for athletes who are competing in sport during their periods?
You mean if they are allowed to compete, they can, they are allowed to compete and they are allowed to do sports during their menstruation. They are also invited to do that. I think that the team from SO Canada will give us some information about hygiene products and also what you can do during sports. If you relate to cramps or severe pain during menstrual bleeding, you can, there are various possibilities to deal with it. Since there is like the uterus, you have the uterus and you have the endometrium in the middle, but it's also a really strong muscle. And what is happening is when the menstrual bleeding comes, when you have like a little stitch or something and it bleeds, then what you do, you push on it. And what the uterus is doing is also pushing on the endometrium so that the bleeding stops. And this is what causes the pain. So what you can try is high dose magnesium to get like the muscle a little bit like softener, or to take painkillers, for example, ibuprofen or something like that, because prostaglandins, which also causes the pain during menstrual bleeding, gets lower with ibuprofen. Some women get relief with heat, not heat. I'm looking for the English word for it. I'm sorry. Is that an answer that helps you? Heat compress, right? Thank you.
Yes, it has helped me. Thank you so much. Thank you, Dr. Katharina. Next, I would like to introduce our second presenters from Special Olympics Canada. We have got an amazing team here today. First, please welcome Brock Reissner, Manager for Health and Research Initiatives for Special Olympics Ontario. Brock helps run health programs like Healthy Athletes and Healthy Communities. Next, welcome youth programs for Special Olympics Nova Scotia. Russia developed the first Special Olympics sports bra fitting program in Canada. And also teaches athletes about breast, menstruation, and pelvic health. Next, we have Sheryl, Senior Manager for Safe Sport and Advancement for Special Olympics Ontario. Sheryl has been a volunteer for Special Olympics since 1990 and has a background in child welfare. Next, we have Dr. Laura, Assistant Professor for University of Calgary, Alberta. Her research looks at how physical activities and girls with developmental disabilities. Finally, please welcome Victoria, Health Manager for Special Olympics Canada. She works to improve the health and sports experience for Special Olympics athletes and supports fair access to healthcare for everyone in Canada. Welcome, Special Olympics Canada. Please take it away.
Thank you so much, Barbara, for that great introduction. I think we can switch to our agenda slide because Barbara's introductions were fantastic. So in Canada, women's health has very much been a team effort. For our time spent with you today, we'll be sharing health information specific for female athletes within Special Olympics, health programming to support and enhance women's health, and then Canadian research to support change for female athletes within Special Olympics. On the next slide, I'll just quickly provide you an overview of some of the common health challenges faced by individuals with intellectual disabilities. As a health team in Canada, we work to focus on improving the health and well-being of athletes within Special Olympics and support them in becoming the healthiest and best athletes they can be. Through this work, we recognize that individuals with intellectual disabilities face a higher risk of chronic illness and unaddressed health concerns compared to the general population. Globally, this is due to a number of factors, such as limited access to healthcare, some communication differences, and sometimes missed opportunities for routine preventative care. Compared to their peers without disabilities, individuals with intellectual disabilities are more likely to experience a range of untreated health issues. These include vision or oral health problems, bone and joint challenges like osteoporosis, and some chronic conditions such as diabetes or cardiovascular disease. They often have limited access to healthcare education that is really specific and tailored to their unique needs. On our next slide, we'll focus more, of course, on women. Within our health team, we came together and dove into the research with a specific focus on women's health and intellectual disabilities. And the disparities that we uncovered were incredibly stark. The health gaps between women with intellectual disabilities and those without disabilities were even more pronounced than we had originally anticipated. Compared to women without disabilities, research shows that women with intellectual disabilities face greater challenges with menstrual health, have significantly lower rates of routine cancer screenings, and receive less support during transition from pediatric to adult care, and are often far less provided with education around puberty, menstruation, and body autonomy. These health disparities are further compounded by social barriers. Globally, women with intellectual disabilities are more likely to experience poverty, have fewer educational opportunities, and report higher levels of discomfort during sport participation, especially around their menstruation cycles, often due to some basic not having access to properly fitting bras. On the next slide, we'll dive into some Canadian specific data that we looked at. What we are seeing in the research really mirrored some of the health data we were already seeing here in Canada. It also strongly aligned with the 2024 Canadian Women in Sport Rally Report, which emphasized the need for health-specific programming to help women in Special Olympics live their healthiest lives, feel confident, and stay engaged in sport. In 2023, Canadian registration data revealed that we have about 10,000 fewer female athletes participating in sports program, and that overall our female athletes were not as healthy as their male peers. These findings reinforce why dedicated health programming is so important. It aligns with the Rally Report's call to action to expand health efforts in ways that increase female athlete engagement, support their confidence in sport, and prioritize their overall health and well-being. On the next slide, I want to shed light on some really encouraging things for women within Special Olympics. And while we recognize that health challenges that they do exist within female athletes within Special Olympics, there's so much exciting progress and momentum to build on. For example, in Canada, we have almost 3 times as many female coaches as we do male coaches. This creates an incredible opportunity for female coaches to be strong leaders and role models for our female athletes. As female coaches and health staff, we're in a really unique position to offer mentorship, boost female athlete participation, and support our athletes in living their healthiest and most confident lives. I'm also proud to share that through the work of my colleagues at Special Olympics Ontario, Special Olympics Nova Scotia, and the University of Calgary, we've all come together to expand women's health initiatives that empower female athletes and help them thrive in sport. I'm now excited to invite them to share more about how they're making this vision come a reality. On the next slide, you'll hear from our colleagues at Special Olympics Ontario through a pre-recorded video.
Okay, good morning, everybody. Thank you so much for being here. My name is Brock, and this is my colleague Sheryl. We're from Special Olympics Ontario, and we're here to tell you more about some of the important women's health work that we've been doing within the province of Ontario, some of the work that we've been doing and where we're looking to go. So I'm going to pass it over to Sheryl, and she's going to start our conversation for us today and tell us more about how we were inspired to start this work.
Thanks, Brock. Good morning, everyone. My name is Sheryl Huestis, and I'm delighted to be with you all this morning. I'm a senior manager here at Special Olympics Ontario, and this subject has been very, very near and dear to my heart. I'm really sorry we couldn't be with you today, but today is a holiday in Canada, so we'll be enjoying the fireworks and time with family and friends today. I was asked to give a little background on how we got started with women's sports and women's health here in Ontario. And so with the growth of women's sports in Canada, I was really curious as to why our numbers were the way they were in regards to women and girls playing team sport. So I thought, I'm just going to start asking the question as to why the ladies had left a co-ed team or why they wouldn't consider playing on a co-ed team. And the ladies were really, really clear with me. What they said was the game was physically too rough for them. The boys were bigger, stronger, faster. And one lady told me, not only do I never get the ball, but in 6 years, I was never able to score a goal. And so that really registered with me and really, really got me thinking. So in 2015, Special Olympics Ontario recognized there was significant interest in team sport for women and girls. So SOO initiated efforts to enhance participation of women and girls in sport, but at the same time, focusing on their health needs. So by 2017, this work culminated into a women's only soccer tournament, while also expanding to cover critical health topics for women and girls, such as breast and pelvic health, bone density, and nutrition. These efforts then set the stage for women's only soccer team within SOO, and with plans and a goal to include a women's only division in the 2026 Unified Cup and in the 2026 Special Olympics Canada National Games. So while it's taken us a little bit of time to get here, we are very, very pleased, and we see endless opportunity for women and girls in sport in Special Olympics and focusing on women's health issues. So thank you for inviting me. I wish I could have joined you in real time. I'll now hand it back over to my colleague, Brock.
Thank you so much, Sheryl, for that inspiring story. So I'm going to start to talk more about the health work and how when I joined the organization in 2022 as the manager of health and research, I was very inspired by Sheryl's story and the work she got started in women's health and women in sport. So one of my goals was to expand our focus within this area. So working closely with Sheryl, we supported the development and integration of educational workshops on pelvic health into our Healthy Athletes health promotion programming. And we've also partnered with the Women's College Hospital to build a framework for future women's health initiatives. So that work came to life at our 2024 Provincial Games, where we provided health education and collected data with a focus on breast health and self-exams for athletes with IDD. So this effort really marked a shift for us, and with the Women's College Hospital, it really showed that we have a growing commitment to supporting the specific health needs of the female athletes in our community. So I was going to tell everyone a little bit more about the specific work that we were doing with the Women's College Hospital and how that came to life and how it was integrated into our games. So the programming itself was developed and led by an amazing team at the Women's College Hospital. This is a leading academic ambulatory hospital in downtown Toronto, Ontario, Canada. They specialize in women's health, gender-sensitive care, outpatient services, and they're known for their focus on equity, research, innovation, and advancing health system solutions for diverse populations. So they approached us looking to get involved with Special Olympics and being able to provide care and services to the women within our community. So they brought in a range of hands-on tools to help athletes feel empowered to talk about and take care of their health. One of those standout tools was a breast self-examination model kit. So athletes could actually feel for lumps and practice the self-exam technique, and it was incredibly well received. And another tool was the Feel for Yourself breast lump display. So it had different types of breast lumps for athletes to physically feel, helping them understand what they could notice during an exam. So it was really powerful education provided right on site at our games in collaboration with the hospital. We had nurses and doctors on site having these conversations with women athletes. So to continue building on our commitment to women's health, we also hired a medical student as an intern to help us create new accessible health promotion materials. The goal was to address some of the most common and critical knowledge gaps we see in our community. These materials focused on key areas that weren't getting enough attention: menstrual health, breast health. So in those key areas, really focused on menstrual health, breast health, and pelvic health as well. So the athletes, we have a photo there. The women athletes are sitting around and engaging in a workshop with our medical student, learning about those topics. So with this new content, we were able to expand our Healthy Athletes curriculum. We took the Healthy Athletes health promotion branding, the guidelines, the education stations, the materials that are already in there, and adapted those so that they were centric to women's health and those specific needs that we've been talking about. So we did this in a very meaningful way. It wasn't just about distributing information. It was about helping the athletes understand their bodies, ask questions, and feel confident advocating for their own health. And we're really trying to do that in a way that's approachable, inclusive, and empowering to the women. And finally, another initiative that we've undertaken to help support the women in our community is a sports bra fitting program. So this was piloted at a first event with 30 female athletes in Ontario. We brought in professional fitters to ensure everyone received the right support for their body and sport. So after this fitting, each athlete received a personalized report that outlined the correct size, highlighted why proper support is so important for both comfort and athletic performance. And we covered the cost of these bras for the ladies and had them shipped directly to their homes to make things easy and accessible for them. I think one of the most eye-opening parts of these events is that none of the athletes knew their correct bra size beforehand. So out of all the female athletes that have participated in the sports bra fitting program, not one had an accurate reading or had an accurate understanding of what their bra size is, or how to necessarily source a proper sports bra to support them in their sporting. So this initiative did provide more than just equipment. It helps the athletes feel more comfortable and confident in their bodies. And it really helped us address some real health concerns like the skin infections and discomfort that come along with poor sports bra support. So this experience really enforced for us how critical proper education and resources are when it comes to female athlete health and getting them the essential resources they need to perform their best and be the healthiest on and off the playing field. So that is all the time we have today on behalf of Special Olympics Ontario. I wanted to thank you for listening. I hope you feel inspired by some of the work that we've been doing. We are always available. As me and Sheryl, please reach out. We would love to tell you more about the work we did, share the resources with you, help get these into your hands and help you implement it in your region. I'm now going to pass it over to Rachel Skanes from Special Olympics Nova Scotia, who is going to tell you more about the important work that they've also been doing on women in sport and women's health. So over to you, Rachel. Thank you, everybody.
Awesome. Thanks, Brock. And thank you to SOI and the Airy Real Foundation for asking us to be part of this webinar. And we're thrilled to be sharing our work in this area with you. So as Barbara said earlier, my name is Rachel Skanes. I'm the Director of Youth and Health Programs with Special Olympics Nova Scotia. And I'll be speaking to you a bit more about how we've worked towards filling the gap to adequate menstrual, breast, and pelvic health for our athletes. So Brock at Special Olympics Ontario has been doing some great work, and we at Special Olympics Nova Scotia were doing some great work at the same time. So eventually Victoria got us all together, and we started sharing some of the great stuff we're doing so we could advocate more as a more cohesive group. Next slide. So a little bit more about me. I became really passionate about this topic a few decades ago when I struggled with my own health journey. So for a long time, I struggled to understand what was going on with my own body until I received a diagnosis, finally, of endometriosis, which is a very complex women's health condition characterized by chronic pelvic pain. So having a lot of difficulty navigating the healthcare system for myself in Canada, but as I've talked to other friends who have it in other countries, it's difficult to navigate across internationally. So I wondered if it's difficult for myself, how are our athletes with chronic pelvic pain and difficulty during menstrual cycles navigating their own health world? So then one of my really good friends she's a childhood friend of mine that has an IDD. She was diagnosed with endometriosis as well. And then I truly understood or began to understand the huge gap in adequate healthcare for women with IDD. So that's kind of where we started. Then after my first summer games with Special Olympics Nova Scotia, I noticed how many of our athletes did not have adequate sports bras and breast support while competing in provincial competition. Our coaches, a few of our coaches had gone to national games or world games, and some of our athletes didn't have adequate sports bras. So our coaches were helping our athletes purchase bras there, but maybe didn't necessarily have the training to be able to help our athletes navigate how to purchase a supportive sports bra. So how could we do something to help our athletes do that? So this was not only important for sports and athletic performance, but we were wondering how it was impacting health of our athletes. So we formed a sports bra and pelvic health team in Special Olympics in Nova Scotia that including experts in the field to help us remove a lot of the barriers for women in sport and for good women's health. Next slide. So at our next summer games, we partnered with a local lingerie company with inclusive bra sizes. So just to give you an example, we gave out a J cup, a bra that was a J cup at our games. So we really needed a company that had a wide range of sizes and that had expert fitters that were really knowledgeable on how to fit our athletes well and had some experience with athletes with intellectual and developmental disabilities. So we implemented our first ever free sports bra fitting program. We prioritized athletes in sports, so it was funded through Special Olympics Nova Scotia, but we realized we didn't have enough for all of our female athletes, so we prioritized any sports involving running or jumping, which research shows that causes the most damage to breast tissue if the breasts are unsupported. So those athletes in priority sports were given the free bras, but those that were in other sports were still able to do the fittings and received a card that shared the recommended sizing, the recommended bra, what to look for, and those kinds of information. So of the 90 athletes that were fitted throughout our games, 50% presented with candida, yeast infections, or some form of skin breakdown on their chests. This was made worse, if not caused, by our athletes wearing inappropriate bras during physical activity. So as you can imagine, if you've worked with our athletes, they often have a higher BMI, which means often they have larger breasts, especially in summer games when it's really hot. Sweat can get trapped underneath the breast tissue, and this can lead to infection as shown in the photo on the right. So the photo on the right is one of our athletes that is really from our pilot program that presented with skin irritation. This was not even close to the worst case scenario that we saw throughout the day, but I did receive consent from the athlete and their parent to show the photos for advocacy and education purposes. So 50% of our athletes presented like this. So we were able to fit them with appropriate bras to help prevent that moving forward. Other reported benefits included improved self-esteem, greater athletic performance, improved posture, decrease in pain and discomfort. We had one athlete that even said she had never felt so beautiful as she did after receiving her new bra. We collected a lot of feedback from coaches and athletes, so not just the quantitative data that I've already shared, but some quotes and other feedback. So one of the quotes we had from an athlete was, "I was so happy to have this fitting done. The ladies doing it were awesome and made me feel comfortable. I felt more comfortable about myself and my appearance after the fitting of a proper bra. I hope more people get to experience this." And then we had a coach that said, "I must tell you that there is no doubt in my mind the new bra made such a significant impact." Sorry, my cat is getting in my way. On the subsequent performances of our girls. It just seemed to give them more confidence, determination, and improved ability. And she earned 2 medals to prove it. Remarkable, really. So that shows the increase in self-esteem, the immediate effect that we saw, and also the immediate impacts we saw to athletic performance. So after this and collecting all the data, we realized that this work needed to be continued and that we needed to be able to offer free bras to our athletes. Our athletes typically don't have a lot of financial support. So we applied for a grant through the Airy Real Foundation, who gave us the funds needed to continue the program for all of our athletes. So we implemented the program again with a few critical changes. So the next time we implemented it, we partnered with Dr. Laura St. John, who you'll hear from momentarily. Dr. St. John heard about our results from our pilot and brought some antifungal and barrier creams for our athletes to help treat the chest infections. And we positioned our sports bra fitting beside our MedFest screenings so that our physicians and clinical directors through MedFest could assess our athletes for candida or yeast infections when presented, and then give the appropriate creams and prescriptions on site. Our pelvic physiotherapist partner created information handouts regarding menstrual, bladder, and bowel health. And then Dr. St. John gave this information to our athletes and provided some critical education and gave out some menstrual products. Laura or Dr. St. John also completed some research surveys with our athletes. This assessed their knowledge about menstruation and their own menstrual cycles. That helped us inform what we were going to do for the next program, and Laura will share some more of these findings when she speaks momentarily. Next slide. So we continue to implement these programs throughout the year. So our next program coming up is Summer Games and then our Fall Screening Day. So we hope to include for that some more in-depth evidence-based information about menstrual health with period underwear and other menstrual products available for our athletes that don't always have the financial resources to fund these on their own. Some bladder and bowel health education, which will include our male athletes as well. Some information about comfortability in sport and education around that for male and female athletes. We'll give out some coach and caregiver resources. We hope to include some pelvic health resources, for example, how to get a mammogram for our rural athletes who maybe don't have a family physician. And then some social stories that would be aimed at making athletes more comfortable with various women's health procedures. So, for example, for those mammograms or PAPs, so that they get more cancer screenings done. As Victoria said, our athletes aren't doing routine cancer screenings as much as they should. So we have lots more that we hope to do in this area. We can't wait to help our athletes feel more comfortable in their bodies and understanding how to care for themselves. So thank you so much for having me and the rest of our Special Olympics Canada team. As Brock said, please reach out to us. I think Vic's email is at the end of this presentation. So reach out if you're interested in having women's health programs as part of your games, or if you're interested in learning more in this area. So I'm now going to pass it off to Dr. Laura St. John, who's going to talk about this area more as a researcher and with her research experience.
Hi everyone, my name's Dr. St. John. I'm a researcher at the University of Calgary in Calgary, Alberta, Canada. And thanks for having me and allowing me to speak on this topic. A little bit about me. So I was an athlete for the majority of my life, and I certainly dealt with the ramifications of period health related to athletic performance while I was still working on my research. So when I was 27, and I was really focused on the health of individuals with IBD. I was diagnosed with endometriosis, which is a reproductive health condition that causes severe cramping, very painful periods, and which prior to my diagnosis left me hospitalized often, and something that really impacted my ability to play sport and participate in physical activity throughout my teens and into my early 20s. And I remember having a conversation with one of my colleagues at the time once I got that diagnosis and discussing how, how crazy it was to think that there was likely women and Special Olympics athletes who maybe had these conditions or were dealing with period health issues, and how that might be really impacting this population. And so that became a big focus of mine, was how can we support women with intellectual disabilities through reproductive health issues and improve their physical activity and physical activity engagement by supporting that period of their life. So the menstrual cycle is a natural monthly process, and it occurs when a female's body is preparing for pregnancy, and if a pregnancy doesn't happen, that is when we have a period which occurs. And symptoms when someone has their period can really vary. They can be a bit of a nuisance to incredibly debilitating. And for many women and girls, this is certainly an issue. So in 2024, the Canadian Women and Sport Group released the Rally Report, and they surveyed 2,000 women, and of that group, 1,000 reported that their period negatively impacted their physical activity participation and their ability to perform at their best when they were participating in their sport. So kind of building off of that information and my own interest in the topic, I did a research study looking at menstrual and period health in this population. And what I found is that women with intellectual disabilities report much more severe symptoms related to their period, and it really impacted their quality of life and impacted their ability to actively engage in sport. And based on my study, I kind of postulated, okay, there could be a couple of reasons. And the two things that I thought about was it could be a lack of knowledge and understanding. Again, if we're not knowledgeable about a topic, it's really hard for us to handle or manage that topic. And it could be related to not having sufficient skills related to self-care or an ability to perform self-care skills independently and effectively enough to actually be able to manage period symptoms. So kind of building off of that work, I partnered with Special Olympics Nova Scotia, realizing there was this sort of connection around an interest in women's health. And in fall 2024, I attended the Healthy Athletes event, where I was able to survey women athletes related to menstrual health and women's health. And they answered questions about their knowledge, understanding, attitudes around women's health topics, and as well as their ability to perform hygiene and self-care skills independently. What I found from that survey was pretty alarming. Very few athletes actually had an effective understanding of what menstruation was. About a quarter of my athletes knew what menopause was, which was really concerning given that over half of the sample was in that age range that we would anticipate having gone through menopause. So it was worrying to see so few who actually knew what menopause was and what it meant in relation to their body. There was really poor understanding around hygiene practices. So how often one should change a period product. So how often they should change a tampon. So in general, it's suggested every 4 hours, and that's to reduce chances of infection, reduce chances of toxic shock syndrome. Around over half of the athletes, I want to say close to 75%, said that you only need to be changing your hygiene products once a day. So that does put this population at a really high risk of developing these infections and toxic shock syndrome. The majority of athletes felt like they weren't able to independently perform hygiene tasks, especially using a tampon. And while again, it's not necessary that a woman be able to use a tampon to manage their period, it is something that certainly improves an athlete's ability to perform. We know that tampons provide more protection, they provide a sense of security when a woman is physically active, so that certainly would relate to this population as well. The information that I've gathered from the study with Special Olympics Nova Scotia and the other research that I've been doing, I have started to work on developing evidence-informed resources and tools for athletes to better support them with their menstrual health and ensure that they're able to be physically active and engage in sport to the best of their ability, regardless if they're experiencing their period or not. So we've developed materials related to menstruation and menopause, all with the practical and biological information necessary for an athlete to be able to effectively manage these two things. And these are all easy read materials, so they are easy to understand and accessible. We're also providing information to coaches and caregivers and the athletes. It's really important that when we're developing these materials, we consider kind of who's in that person's center or, circle of care, and giving everyone a shared language around these topics. The other important piece is that we want to ensure that caregivers and coaches have the competency, have the confidence related to these topics so that they can effectively support their athletes. And then the other thing is we're really encouraging athletes, coaches, caregivers to consider how menstrual health, and I know breast health has been talked about as well, how that can improve and support their athletes' performance and support their ability to engage in sport. And then the other piece is rethinking and reconsidering what we deem as sport equipment. So for women's Special Olympics athletes, or for athletes who manage or deal with a menstrual cycle, equipment isn't just their skates or the shoes they wear to soccer or their basketball. It is really considering everything that the athlete needs to be equipped to perform at their best. So whether that's finding a way to provide access to period products or encouraging athletes to have proper fitting bras, these are all things that we need to support athletes with so that they are able to perform at their best, which is really what we want.
So in closing, I would like to thank Special Olympics International, the Real Foundation, my colleagues Rachel Skanes, Sheryl Huestis, Brock Reissner, and Dr. Laura St. John. Before I hand it back to Barbara to close us out and ask any final questions, some goals in Canada that we hope to do is to continue this work within expanding it within our country. So sharing this work with other provinces and territories in Canada. And then in 2026 at our national games, we will be hosting a women's only soccer division and hope to have some women's health events along with that. And then we really want to be here to support other delegations in their efforts to achieve equity, inclusivity, and health and sport for women. So I've linked here some really great resources available in English and French you're welcome to use. And I've also put them in the chat for you to click directly to that link. And I've also provided my email address. If you have any direct questions for our team here, we're happy to support in your expansion in women's health. Thank you so much for listening to us this morning.
Wow, what a great information. Thank you, Brock, Rachel, Sheryl, Dr. Laura, and Victoria. You shared some valuable information, and I have learned some helpful tips I can use in the future. Thank you. I invite our attendees to share their questions. But also I want to ask you a question. If athletes want to learn more about women's health, who can they talk to locally?
That's such a great question, Barbara. I would definitely start with the resources that we've shared and redeveloped in collaboration with CAMH. These resources were shared specifically for athlete education, caregiver education, and coach education. So athletes, I think, should feel welcome to go to their local coaches, feel supported in those conversations, as well as go to their local Special Olympics staff who can help them navigate some of the health challenges that they might be faced or feeling. As well, it's important to go to your caregivers if needed, to have support with going to your doctor or just having really open conversations about some of the health challenges that you're facing. Rachel, is there anything you want to add to that question?
Yeah, I'll just share that some of the resources or all of the resources that Victoria shared that we have through Special Olympics Canada talk about what's normal. So it really gives athletes a good way to say, okay, well, maybe this isn't normal. And it shares a heading of when to see a medical professional. So when to reach out for help, what is normal and what isn't normal, so that athletes can advocate for their health a little bit better.
Okay, thank you. Thank you again to our speakers today. Thank you again to our speakers today for sharing your knowledge. I can't believe we are coming to the end of our webinar, but what an amazing webinar it has been. I hope you have learned much as I did. Here today, Men in Sport webinar series, proudly presented by Real Foundation. Over the 3 webinars we had about the important role mothers play in sport. We had amazing women in coaching. And today we had learned how women's health in sport can help athletes be healthier, stronger, and perform at their best. Our webinar recordings can be found on the Special Olympics YouTube. Be sure to watch and share them with friends and families and anyone involved in sport. Finally, thank you again to our sponsor, the Real Foundation, for their continued support for Special Olympics Women in Sport webinar series. Thank you. Goodbye.